Go here. Okay. All right. Good afternoon, everyone, and welcome. My name is Carla Zevnik-Seifzer, and I'm an advisor as well as the president of ClearStep Financial. And I want to welcome everyone to today's presentation, Planning for Social Security and Medicare. One of the goals of ClearStep Financial with our team members and our advisors here is to educate and teach about money and finance in our ever-changing financial world that we live in. So to help us accomplish this, we have a very special guest speaker, national speaker from Nationwide, Roberta Eckert. Her background is about 32 years in the financial industry. She has many designations and licenses. She is the director of the Institute Insights and Solutions team at Nationwide. And one of her statements is that she stimulates the thinking and actions of professionals as they navigate in the ever-changing world of retirement planning. And isn't that true? The world is changing. So please, any questions, please put in the chat if you have any specific questions, and Roberta will answer those at the end of the presentation. And with that, I will turn everything over to Roberta.
Thank you, Carla. And hold on one moment, because we're going to start talking a little bit about healthcare and healthcare from the perspective of Medicare, because that's what everybody's having questions about these days. So give me just a minute. Let me get this. There we go. You can see my screen okay, I think?
Yes, we can.
Okay,
Thank you.
super. All right. So, in fact, this is really good timing because open enrollment begins October 15th for Medicare. And a lot of you might be saying, well, wait, that's not me. I'm not on Medicare yet. But just like anything else, you want to be thinking about some of these things sooner rather than later, and not right up to the moment where you're ready to make some decisions. And really, that's what we're going to talk a little bit about. We're then going to swing over and talk about Social Security. I'm going to stick to my time. We're pretty good at that. We've been doing these presentations for about 15 years. So you will miss nothing, even though my computer decided to say, yeah, I'll get to you as soon as I feel like it, which I'm sure everybody on this call has had that experience at one point or another. So when we're talking about healthcare, what we're really talking about is the fact, really two things. Let me go back to my title there for a moment. Two things. Number one, when we do a lot of research at Nationwide, what we found is that a lot of people think that once they go on Medicare, that their plan or their benefits, if you will, are going to be picked up by Medicare right where their employer left off. And that is absolutely untrue. The second thing is people are really unaware that if they don't adhere to some certain time frames regarding when to sign up, what the penalties are, and those kinds of things, that there can be penalties that are expensive and can last for, theoretically, the rest of your life. Now, again, we're not going to get too deep in the weeds about Medicare, but what happened to my slides here? Hang on one moment. Oh, my computer's just decided to be a little funky today. Hang on, here we go. Okay, Carla, all good there?
We do not see the slide, Roberta.
All right, hang on. Okay, let's go back to you guys. Okay, here we go. And oh, my goodness. All right, you should have it now. Let me get my secret.
Yes.
Okay, you should get it now, right? Okay.
Yes,
so what a lot of people also don't realize is, just like anything else, you need to do some planning for any kind of choices that you're going to make in retirement. And also, the other thing that people don't realize is that when you pay for healthcare, when you come to retirement, it's going to be one of the largest expenses that you have, and it's going to last for the longest period of time. So I've got a little disclosure slide up here. It is simply telling you that I am not here to give you any tax advice. I'm not giving you any legal advice. And when it comes to financial advice, that's where Carla and the advisors at ClearStep Financial, who are really great at income and retirement income planning, can help you, because this is a big component of your retirement is, the whole concept of healthcare. So my group is called the Nationwide Retirement Institute. And I'm not going to belabor the point about what I do so much, other than when we talk about healthcare to financial professionals or uh, clients of financial professionals or whomever our audience is, I would be remiss if you got up and said, well, all that's great information, but what do I do next? So I want to concentrate on that middle icon, which is the part that says tools. And the really nice thing that we can provide to you through our friends at ClearStep Financial is a tool that creates a report. And what this report does is lay out and dial in very closely to what your own anticipated healthcare costs are likely to be, because you don't want to get all the way to retirement and realize, oh, let's just guess at this number. It's an expensive number. And I think if you can do a lot more than guess or speculate, you're in really good shape. So the point of that is that in a few moments, I'm going to show you a little bit about how that tool works, but I will put your mind at rest and tell you that the tool carries with it no obligation. It costs you nothing, and it's a great way to put one of those building blocks into retirement income planning into place. Well, why do people need to plan for this? Well, I already mentioned it's expensive, and there are a lot of groups that do a lot of research on this, including ourselves. But at the latest number that's come up, and you see this every year or so, is that the out of pocket, that means what you're writing a check for, healthcare costs in retirement for a 65-year-old couple, that's two of you if you're married or not, but two of you together, with average premiums is about $351,000. For some people, that's the cost of like a new house. Maybe not so much these days because housing's gotten super expensive. But we also have found out that people fear that healthcare costs are getting out of control. Not a whole lot we can do about controlling healthcare costs, but there is quite a lot we can do about looking forward to, or looking in the future, seeing how much it could conceivably be, right down to where we want to retire and making a plan. It's all about making a plan. So the three things I'm going to chat with you about today. First, the current state of healthcare, understanding some of the things you need to be aware of and can plan for right now. And then we'll take a quick peek at our tool and show you kind of how that works and the types of things that it will communicate to you. Well, first of all, it's no shock to anybody here on the call that inflation is a thing, and it has become a bigger thing over the past several years. But when you compare healthcare costs to the inflation factor that's attached to average goods and services, groceries at the grocery store, gas, buying a new sofa, whatever it is, that healthcare inflates at a much quicker pace and a much faster clip than any other goods and services that you're taking, that you're utilizing. And there is a group called Milliman that we also use for some of their research. And what we're finding out from them is that where does that healthcare dollar go? About 30% to professional services, your doctor, for example, about 30% getting outpatient procedures done, about 25% at the drugstore getting prescriptions filled, and about 17% if you go to the hospital. So, it's all, I don't want to say evenly split, but there's nothing that is weighed too heavily towards one factor or another. And those are all the things that we'll take into consideration when looking at the report that we can create for you. I mentioned a couple of surprises about healthcare costs that people, when they reach retirement, have told us that they were a little startled about. And one of them is they thought Medicare was free. It is not. Just because you might have been paying some premiums along the way doesn't mean that it's free. And we'll get to that in just a couple of moments. And also because sometimes it's so easy to overlook the amount of healthcare that is paid for by an employer, either subsidizing the costs or paying some of the premiums for you. Whatever it is, it's just very easy to kind of forget how much it really is. So give you a quick example about that. My own healthcare and my spouse's were covered by our nationwide plan. And that premium is coming out of my paycheck. So I really don't look at it all the time. I'm not writing a check to it every month or every 2 weeks. It's just sort of absorbed. So it's very easy to kind of not realize what that cost in the aggregate really is. And so we want to eliminate some of those misconceptions, like we do with all of the topics that we take on, because we want to make sure that when you get to retirement, regardless of what choices you make with any of these different areas, you don't look back and say, I wish I had known X. And so that's what we're here to do, is work closely with ClearStep to say, let's make sure everybody understands all of the different components of the different retirement choices. So with that, let's take a quick look about Medicare, because again, even if you're not Medicare eligible right now, there's still some things you might need to put in place sooner rather than later in order to make sure that you're all set up. Well, first of all, I think everybody here knows if you're 65 years old, you're eligible for Medicare. Now, that is despite any pre-existing conditions you have. It doesn't matter how much money you make. It doesn't matter what your gender is. You are eligible for Medicare. You could be eligible a little earlier, but I don't wish that on anybody, because it means you have end-stage renal disease or you have ALS. So that's a horrible way to qualify earlier. The other thing is, okay, I'm 65, now what? Well, now you have a 7-month window in which you can enroll, should enroll, in fact. And this is what I was talking about or referring to a little earlier when I talked about penalties. If you do not sign up within this 7-month initial enrollment period, then there could be penalties, or they could do what's called rate you. And that on some other tack on pieces of Medicare, I'll tell you what I mean by that in just a moment. It means that they could charge you more, that pre-existing conditions might play a factor. But if you stick within this 7-month initial enrollment period, which is 3 months before your 65th birthday, the month of your 65th birthday, and 3 months afterwards, which frankly, I think is a pretty good window there, then you are good to go. Again, if you have pre-existing conditions, that's not going to impact you negatively in any way. Well, we get these questions a lot. Well, what if I'm still working at my company and I'm covered by a healthcare coverage there? Do I need to enroll when I'm 65? What if I'm 67 and I'm still working? Well, that's okay. We always say that you probably want to chat with your HR people to make sure that the coverage is aligned if you do decide to sign up for Medicare anyway. But the point is that once you leave that company now and are no longer covered by a healthcare plan through your company or through your spouse's coverage, once that coverage stops, then you have an 8-month special enrollment window in which you sign up for Medicare. And again, none of those penalties would come to play because you signed up, quote, late. So it is perfectly okay not to sign up for Medicare at 65, provided that you are covered by a creditable plan. You want to check with your HR department to see if the plan that is covering you or your spouse's plan that's covering you is creditable. I will tell you that most of them are, but it's okay to keep coverage through your employer even past age 65. And then when you've severed that service, then you go and you've got that special enrollment period that lasts for 8 months. Now, at this point, a couple things you want to be thinking about. And again, just like anything, there are going to be probably some changes going forward. But right now, this is what we're faced with. What you've got is 2 choices for Medicare. One is called Original Medicare, and that's comprised of 4 moving parts. Original Medicare is A and B, and then there are 2 parts that are offered by private insurance companies. Public service announcement / full disclosure. Nationwide does not sell these components. We are here simply to educate you. So we're not in the business of trying to get you to sign up for our Part D plan. It doesn't work that way. But with Original Medicare, that's A and B, hospitalization and medical. And then understanding you probably ought to have a prescription drug plan and a plan that covers things that Medicare covers but doesn't pay for, then that really is very good comprehensive coverage. Or you could go with a Medicare Advantage plan. And you see that where that banner along the bottom says Part C only, and that's in the same color as D and Gap Medigap plans. That's because these plans are offered by private insurance companies. A and B is national health care coverage offered by the federal government. It covers you from coast to coast, and allows you to see any doctor that accepts Medicare patients, get any procedure that's covered by Medicare. But Part C or Advantage plans work a little bit more like a PPO or an HMO, where it is geographical in nature. If you leave the plan or if you get coverage out of network, then you might pay extra, or the procedure or the physician might not be covered at all. So those are some considerations for you. But typically, the Part C Medicare Advantage premiums are lower. Sometimes I've even seen people say, I don't pay any premiums for Part C. Well, they've got to get some money from somewhere to pay for your coverage. So, but Part C, Medicare Advantage plans, geographical in nature, you need to stay in network or be conscious of that. Whereas A and B might cost you a little more. It might cost you more to have, but might cost you, a little less to use. We're going to go through these for just a moment or two, just to kind of get a little deeper in the woods. Now, Part A, this is your hospitalization. And Carla, if you like, I can forward this slide deck to everybody if they'd like to see kind of this in a little more detail, because I'm not going to talk about each dollar amount there. But suffice it to say that Part A premiums, if you have been working for 10 years or 40 quarters, those quarters don't have to be consecutive, then your Part A premiums have been paid for. And that's where people start misunderstanding Part A. They think that Medicare is free because they're not being subject to any premiums. Well, even though you don't have a premium because you've been paying all along, that doesn't mean there aren't other costs. There are deductibles, there are co-pays. There are co-pays for skilled nursing facilities. So don't think Part A has no cost. It does, but the premiums might be absolved had you been working for that qualified period of time, 10 years or 40 quarters. Now, Part B, this is your medical coverage, going to the doctor, things like that. You do have an annual deductible. It's pretty easy to absorb. I think it's about $20 a month. And then your copay is 20% of what Medicare approves for covered services. And that should raise a little flag thinking, well, wait a minute, what do you mean by Medicare approves? And you would be right by having that red flag in your mind, because Medicare doesn't pay for everything. So they might not approve something. Original Medicare, for example, wouldn't pay for dental, vision, hearing. So consequently, some other elements of Medicare might not pay for that as well. But we'll get to that in just a moment or two. A couple more things about the money part of all of this. And this is where it gets important, I think, even if you're not 65 years old right now and ready to sign up for Medicare. First of all, when you're looking at Part B, this is, again, medical coverage. Part A is hospitalization. Part B, going to the doctor. Now, a few things. The premium right now per person per month, provided that your modified adjusted gross income is $212,000 or less, your Part B premium is $185. Okay, establish that. That's right there on the chart. But take a look at the row over, or the column all the way over on the left, and it says 2023 income. That is not a typo. The 2023 modified adjusted gross income that you make, so in other words, the money that you made 2 years ago, is going to drive your 2025 premiums today. So if I'm 65 years old right now and I'm signing up for Medicare, Medicare is going to look back at my income from 2 years ago to determine what my first year premium would be. And every year it gets recalibrated. So next year in 2026, what they're going to do is look at the 2024 individual income. Now, this is one other thing I want to point out, is that making some plans right now, if you're going to sign up for Medicare, say in 2 years, that's where your advisor can work with you a little bit and say, there might be ways, potentially, in which we can reduce your modified adjusted gross income and therefore avoid paying these higher premiums that you see in the column all the way to the right. And one more thing, this is called the IRMA cliff. IRMA stands for Income Related Monthly Adjustment Amount. And simply put, I'm going to concentrate in the middle column here. We're looking at married income or married filers. And for a married couple in 2023, if they had a modified adjusted gross income of $212,000 or less, each person will pay $185 even per month per person. Look what happens in the next row. If they make one more dollar in modified adjusted gross income, now suddenly each person isn't paying $185. They're paying $259 each for the exact same coverage. And the way I like to think about it is one extra dollar in taxable income means that you're paying about $1,400 extra dollars annually for your Part B premiums. And that same process applies to your Part D or prescription drug plans too. So that's where, again, your ClearStep advisor can sit down with you and say, let's try and get in these levels where we don't subject you to this IRMA cliff and keep you from paying those extra amounts if possible. So there's some things that aren't covered by A and B. I mentioned dental, vision, hearing, foot care, long-term care. That is a big one. We still see a stubborn 63% of people thinking that Medicare covers long-term care, and it doesn't. So that is something that we feel very strongly about. It presents a big risk to someone's portfolio, to someone's retirement, not just from the financial aspect, but from the ability to make choices about your care. So do be aware of that as well. And also the takeaway is that Medicare doesn't cover every single thing. Now there's some other coverage you can get. I mentioned Part D, that's prescription drug plans. Very important to sign up for a plan when you're signing up for Medicare and to review it annually, because the plan that you're in could change. And it might say, I know you were taking prescription drugs. Going forward, we're only going to cover you for generic, or maybe your drug isn't covered anymore. So very, very important once you sign up for Part D during open enrollment to reassess that as you go. And then gap plans are going to cover costs that Medicare would approve but doesn't pay for. A quick example of what I mean by that. I go to the doctor, I get a bill for $100. My insurance steps in and says, well, we'll pay $80 of that, but you're on the hook for $20. That's what we're talking about there. So Part D, I mentioned that it also is impacted by the IRMA surcharge, and that you should change or review your coverage every year. Gap plans are the plans that are also referred to as Med Sup or Medicare Supplement. And those are the plans that will pick up some of the things that Medicare covers but doesn't pay for. So I'm going to move forward just for a moment or two and talk about the plan. The slides that I just went through and didn't really spend time on are plans that address long-term care. And I did want to let you know that we do have a presentation, should you have any interest in this, on what is involved with long-term care, if you are interested in any kind of insurance coverage, or how do you fund it, and what are the risks, all those kinds of things. So I didn't think that we want to spend the time on that today, regardless of my computer issues. So here's what you might want to be thinking about is, I know that whether I'm eligible for Medicare right now or still have a few years to go, want to project what my out-of-pocket healthcare costs would likely be, because that way your ClearStep financial advisor can help you create a plan that addresses that cost. Now, this is a screenshot from the report. It looks like a whole lot of numbers, and in fact, it kind of is. But I did want to let you know that at Nationwide, your advisor has access to our consultative team that can walk through any questions that you both might have on what this is saying. But simply put, what it's doing is projecting out any premiums paid for Part A or B, premiums paid for Part D, A Medigap plan, any additional costs, that would be things that, again, Medicare might not cover. If Medicare doesn't cover it, then your gap plan wouldn't step in and pay for it, because the Medigap plans cover expense or pay for expenses that Medicare covers but doesn't pay for. So consequently, if Medicare doesn't cover it, then the gap plan wouldn't be effective. So in this particular case, John and Jane have all those expenses amortized out year over year, including an inflation factor. And at the end of the proverbial day, what happens, there we go, at the second death, or when Jane passes away 30 years from now, they will have spent out of their own pocket about $20,000 a year on healthcare costs. Certainly, it's backloaded, meaning that you're probably going to incur healthcare costs later in life than you are earlier in life, but that's an expense you don't want to be overlooking. Quick story, and then we'll look at how you get your report and move on to Social Security. My husband said to me, by the way, which I know is code for, I think I'm going to trip you up here. By the way, what do we pay for healthcare? And since our coverage is through Nationwide, he's asking me this question. And I said, I'm not sure. I'd have to look at my pay stub to tell you what we're paying for premiums. I'd have to look at the folder that says healthcare to figure out what we've paid so far in our various providers. I'd have to add it all up. And he made the point that I thought was a good point. We're not starting from ground zero, and then the day we get to retirement, we start spending $19,000. That is absolutely true. You're already spending something on healthcare right now, but it might not be this amount of money. Again, it's backloaded or heavily backloaded, meaning less in the early years, more in the latter years. But creating a plan to help cover these costs, very, very important. And I'll kind of say what I did when I started. It's one of the biggest expenses you're going to have in retirement, and it's going to last for the longest period of time. Not like you're kind of paying off a mortgage. Now, very simply, this form that is involved in creating your report takes 4.5 minutes to fill out. There are going to be some questions about your health. You just answer yes or no. It is confidential. It costs you nothing. But these are the questions that are going to be asked just to allow the actuarial partners that we work with to be able to get very, very close to what your out-of-pocket healthcare costs would likely be. So this is just yes or no questions on the health. Certainly, it's not going anywhere. You're never going to get a call from like Nationwide Life Insurance saying, hey, how about if we, no, that will never, ever, ever happen. So once that gets filled out and sent to us through your advisor, who can help kind of walk you through filling out this form and ask any other ancillary questions that are relevant, then we will send the report to your advisor, and then they will walk you through it, as well as with any suggestions or thoughts about how to make any portfolio changes, perhaps, or some other ideas on how to make sure that this is addressed. So with that, these are just some quick screenshots of the form. Let me just go back to this. Excuse me for bumping around a little. When it says annual income in retirement, remember that is to take into consideration that IRMA surcharge. And certainly you might not know right now. You can take a best stab at it. It's better to get started somewhere. There is no bad place to start. And certainly, if you like, we can run this for you every single year as circumstances and incomes change to, again, always recalibrate those healthcare costs. So I think I've made the case. It's important to plan for costs in retirement. There's inflation factors. We are living longer through medical advances and through some disease eradication and things, of that nature, healthier lifestyles. And you would think that people who live longer have fewer healthcare costs. Well, there's a break even along the way. People who live longer spend a longer time paying for healthcare versus people that are quite ill and pass away or have a shorter life expectancy. So always good to do that planning. So with that, I'm going to stop right now sharing my screen because I want to move over and talk about Social Security, because we've talked about healthcare costs and the fact that it's expensive. but I do have a couple of thoughts maybe on how to potentially pay for Social Security, or I'm sorry, pay for healthcare, and that's through Social Security. So, Carla, can you see the screen?
I'm sorry, Roberta, we cannot.
Okay, hang on. I hit the wrong button again, I think. Give me just a moment. Okay. I think my fingers are a little too fat today. Okay, you should right now. Good.
Yes, thank you.
Okay, sure. Thank you for being my tester. So one way in which you can maybe find some extra money to pay for healthcare is understanding the Social Security rules. And this is a program that we deliver that has been very, very popular for a variety of reasons, but big appetite on Social Security because there are a lot of misunderstandings that swirl around, particularly as it regards to Social Security. I love to read the Sunday paper business section. There's a section there about Social Security, and I'm kind of testing my own knowledge. And every once in a while, I even find that there's a mistake that the columnist has written, but by and large, it's pretty good. But do know that just like we have a tool that can help you identify what your own personal social healthcare costs are likely to be, we also have one that can lay out 3 to 4 different Social Security claiming options for you personally. And that's been really met with great enthusiasm because when it comes to Social Security, there's so much out there that says things like, well, if you're 70, you might want to think about this. Generally speaking, you want to do that. But, you're not a generality. You are you. And we want to make sure that we have created something that is specific to you and that your advisor can use kind of as a linchpin to the total income planning process. So you've seen this before. I'm not giving you any financial or legal advice. Carla mentioned in my introduction that I've been in the business for over 30 years, and I've got a lot of different FINRA designations and different additional coursework done in some areas, but I'm not your financial advisor. And that's why I think it's great that they are hosting this program today. I mentioned you saw this with the healthcare presentation, but nice to know that we have this tool for Social Security as well. So a few thoughts around this. Number one, I think everybody on the call is aware that if you begin your Social Security benefits at 62, which is generally the earliest that you can begin Social Security, you will be locking down a reduction in your benefit. In fact, you'd be locking down a reduction in any benefit. So when you're looking at that, just be aware that waiting is beneficial. However, a lot of people are unaware or think, and we know this from our research, think that once they reach the age that is called full retirement age, that this reduction in their benefit will end and they'll get the full amount that they would be entitled to. And that's not true. But the point I want to make on this slide is that by waiting for 8 years, your benefit could conceivably be increased by as much as 80%. This is a hypothetical example, of course, but it just goes to show you how much money you could leave on the table by claiming as early as you possibly can versus maybe waiting it out a little bit. So that's why we call this the choice of a lifetime. So with that, I'm going to talk about these 3 main things. Again, give you the opportunity to get a report created for yourself that is personalized for you. Just like the healthcare report, it is confidential, it costs you nothing, and there's no obligation. Nationwide has no skin in the game with healthcare or Social Security. So it's not like we're getting any money from Social Security by sending you to them or any crazy stuff like that. So I mentioned something called full retirement age. Now, this is the age that once you turn it, you are going to get 100% of any benefit you're entitled to, whether it's your own, whether it's a benefit that has been that you're eligible for because you're a spouse or a divorced spouse or a um, surviving spouse, whatever the benefit is, if you'll wait till full retirement age, you will get 100% of it. Yet, interestingly, about half of people, according to Social Security Administration, they filed before full retirement age. And consequently, they locked down a reduction in their benefit. So I like to give this quick example. We at Nationwide get paid our paycheck on Friday. And I like to think of Social Security as the paycheck that you get once you're retired, and it's going to last you for the rest of your life. Now, when I get paid on Friday, I would no sooner go to my payroll department and say, I'd be okay taking a 20, 25, 30% cut in pay than I would fly to the moon. And yet people don't realize, I think, the overall impact of doing exactly that with their retirement paycheck is accepting a reduction in their pay. Now, we understand why people might do that, and some reasons are very, very valid. Either the loss of a job, a healthcare scenario, things of that nature. But we also find that a fair amount of that has to do with not understanding the rules and how to make them work to your own benefit. Well, I mentioned full retirement age. That's the magic age. And this full retirement age, notice it begins at 66. It's not 65. If you file at 65, you're filing early and you will be locking down a reduction in your benefit. Maybe not as much of a reduction as if you file at 62, but it's a reduction. Everybody here on the call has a full retirement age of either 66, 67, or somewhere in between. So, for example, if I were born in, 1958, my full retirement age is 66 and 8 months. If Carla was born in 1969, and I don't know what birth date she has, but her full retirement age is 67. So again, it's not 65. It's no later than 67. But if you look at the banner up at the top of my screen where it says early FRA and delay, if you're talking about your own benefit that you got through working, if you delay claiming, there is an 8% credit. It's called it's called a delayed retirement credit. And there's an 8% annual credit for every year or even part of a year that you can wait to file. So let me give you a quick example. Let's say my full retirement age is 67. If I wait till 67 and 6 months, then I will have a 4% increase added to my benefit. Why 4%? Because I waited 6 months, which is half the year. Half of 8% is 4%. So I'm trying to make the point that you don't have to wait for the whole year to cycle through to lock down that delayed retirement credit. And one more thing about it, don't wait past 70. They stop at age 70. So there is no point waiting. You will be leaving money on the table if you do that. So that's how full retirement age works. And yet, when Nationwide did some research, they found that over 64% of people they talked to thought that even if they claimed early, once they hit full retirement age, that their benefit would increase to reflect their full retirement age amount. Not true. You claim early, you're locking down the benefit unless your benefit changes because of any other situational point, such as being eligible as a spouse or eligible as a surviving spouse. Well, I have an example here using Pat and Kelly. Don't want to get too deep in the weeds with Pat and Kelly, other than to say that for them, if they were to have claimed as soon as possible, they would receive benefits that add up to $1,456,572. This is over their joint life expectancy. That is also a factor that some people tend to overlook. Is the joint life expectancy. Using the exact same joint life expectancy, if they can optimize their benefits, then they would receive benefits in the aggregate of $1,683,912. Or put another way, by not taking full advantage of the rules, and being able to delay claiming, then they would have put or left $227,000 on the table. Well, some people say, well, okay, I was thinking about claiming at such and such an age, and I was going to get this much coming in. But if I can delay and get more coming in a little later, what do I do to replace the money that I was planning on having coming in from Social Security for those several years? And that is a great question. And that's also a question to pose to your ClearStep advisor, because they're the ones that can create kind of an income strategy that talks about Social Security replacement. And by replacement, what I mean is replacement for those years that you are delaying claiming, because again, you could see some significant advantages by doing that. So I'm not telling you to claim early. I'm not telling you to take it late. We love to say that all we're doing is telling you to take it seriously. I'm going to go through some basics very briefly. We'll take a look at the tool, and then we will have a few moments for some Q&A. Social Security government program. It's called OASDI, Old Age Survivors Disability Insurance, and it provides really a lot of pretty good benefits. Certainly one that I kind of like is this index to inflation. You don't pay anything extra for this cost of living adjustment. This cost of living adjustment, which is the little arrow going up, that is calculated, probably get calculated next month or so, and it will be effective in January. And this is kind of like, I almost hate to say it, a free gift from the government, if you will, because you didn't pay anything extra to get this cost of living adjustment added to your benefit. It starts getting added at age 62. Do not think that you must claim your benefit in order to trigger the cost of living adjustment. It's going to get added at 62, and it'll keep getting added whether you claim or not, whether you've claimed or not. In other words, don't feel that you must claim, and then and only then will that cost of living adjustment become effective. It's going to start getting added at 62, and we'll keep on going. So that's something that's very important. Your primary insurance amount is a topic or concept I haven't talked about just yet, but that's the amount that if you're looking at your own pay stub your own earnings history, your primary insurance amount is the amount that you will receive if you wait till full retirement age. Full retirement age gets you the ticket to the dance, and primary insurance amount is the amount that you get. It's recalculated every year depending upon your earnings. And what they're going to do is take your top 35 years of wages. If you have worked for 30 years, in order to get this calculation number, they have to put zeros on 5 of those lines because they need 35 years worth of data and you only work for 30. So I don't want to be the one to tell you keep working or at least get 35 years in. But at 35 years, at least you don't have zeros on any of those 35 lines that they need to calculate your PIA. The flip side holds true as well. If you work for 45 years, well, they only need 35 years of wages, so they will cherry pick the highest 35 years, always kicking out the bottom 10 or 11 or 12, no matter, depending upon how many years someone worked, but they only need 35. They're going to take the highest. And that works a little different. If anybody here has a pension, it works differently from than how a pension is calculated. So the takeaway there is if you haven't worked for 35 years, you might want to at least plug along till at least you get the 35 years of wages. And if you work longer than that, then you're in the situation where they'll just cherry pick the top 35 years and discard those lower ones. You saw full retirement age. You're not seeing things. I wanted to show you this slide twice because again, at full retirement age is when you will get your primary insurance amount. And that could be increased if you delay claiming or decreased if you claimed earlier. Always a great idea to review your statement. It's been consolidated over the past few years, I think about 3-4 years ago. They consolidated it, but there's a lot of great information here that you can share with your advisor to kind of help sort of fine tune your own claiming decision and when it's feasible to do that. One thing that's very important is to look at your earnings history, make sure that it's been reported and reflected accurately because you don't have an infinite amount of time to rectify that. You only have about, it's crazy. It's like 3 years, 3 months, and 2 weeks to fix it. So just make sure if you see an error to get it fixed as soon as you can. There has been known that the error percentage rate is something that's not small, I guess. They have been known to make some errors. Notice also that if you are working and claiming, and you have claimed your benefits before full retirement age, that there's something called a earnings test. And the earnings test, pardon me, the earnings test simply says, and again, I can get you these slides. It was never my intention to read every number off the slides to you, but just know that if you are planning on claiming your benefit early and you are continuing to work, that some of your benefits might be withheld while you're doing that. Social Security was intended to be a retirement benefit. And the wisdom, conventional wisdom, holds that if you're claiming Social Security and you're still working, well, you're not retired. So they're going to withhold some of that amount. It's not permanent. Once you hit full retirement age, they will start paying it back. They will just simply alter your monthly check by whatever the factor is, but you'll get that back. But, just wanted to make sure that people were aware about this earnings test. Also, there are different rules for different situations. Whether you're a spouse, a surviving spouse, divorced, if you have dependent children, if you or your children are disabled, if you're a government employee, there are over 2,400 filing rules. And that's why, in my opinion, it's important important to understand how those rules work, either for or against you, so that you've got a really good, clear sight line to what your choices are. And unfortunately, some people rely on the expert of all things, the internet, and that was a little joke there, to make decisions rather than going through an actual process. I'll also tell you that I think probably most of you know this. You can only claim one benefit at a time. I could not claim a benefit based on my own work record as well as a spousal benefit. Whichever is the biggest one is the one that I would claim. And it could be that I'm working along and my spouse hasn't filed for their benefits yet, so I'm not eligible for a spousal benefit. But once I become eligible, now I've got two benefits that I could take. And I'm always allowed, if you will, to get the higher of the two. So that's one scenario where my benefit could change and could increase, is because maybe my eligibilities have changed through either becoming divorced or surviving spouse or things of that nature. So we've got the rules for that we can share with you, but I do want to spend a moment or two talking about the tool. So again, this should look familiar to you because it's very similar to our healthcare report. The questionnaire is a little longer. It might take you 10 minutes. But in this situation, I'm going to share with you a couple of the screenshots. This is just a quick overview. In this case, there are 3 options that Pat and Kelly have. The one on the left will always be communicated to you. That's the one that's going to generate the most income for you. The one on the right indicates what happens if you claim as early as possible. And there's always an alternate. And generally that alternate has to do with claiming at full retirement age. So kind of like neither too hot nor too cold. I call it the Goldilocks option. But for some people, they might want an alternate to reflect my pension went away at a certain age. What if I kick in and claim Social Security then? Or some different one-off scenarios that the tool is able to consider and reflect for your report. Now, for this example, Pat and Kelly are looking at the example on the left-hand side. And for each one of these different scenarios, there are 3 pieces of backup information, supporting information, if you will. In this one, it's actually telling Pat and Kelly what to do and when to do it. Notice the nomenclature that's used. So Pat files a standard application. That's the terminology he uses. He does it at age 70. Kelly the spouse files a standard application at age 66, and it tells what that benefit looks like as well. Now, this is the page I love most of all, because what that does with that scenario looks like this. That gray bar is telling us or showing what Pat and Kelly have said on the questionnaire they want their income to be in retirement. Now, the orange bars simply look back and say that's how much your income was before you retired. But this is the bucket that they need to fill up. That's what that gray line represents. The black lines underneath are saying, okay, with this bucket, how much of the bucket is filled up by Social Security? And that's what those black lines are. So you can see there's a gap. And for just about everybody, everybody has a gap because Social Security was never intended to supply you or provide you with all of your income in retirement. You were always supposed to be saving for yourself on your own or taking advantage of a retirement plan or what have you. Now, this is something where I think it's great to have a financial professional because they can step in and say, okay, well, we know there's a gap. Let's look at the assets you have at your disposal, other income streams, and make sure that we have everything you need in order to fill that gap, maybe even exceed it. That would be great. But let's make sure that we've got that gap filled. And so the next question is, well, how much is the gap? And that's the third bit of information that's provided to you. So, for example, I'll just say this first year with you. In year one, you have the amount of money that's coming in from Social Security for Pat and for Kelly. They've got a total there. They need $119,630. So their gap is $41,894. And so their financial professional might have said, all right, well, you got a $20,000 pension. You've got securities or a fixed, or you have guaranteed income streams, maybe of another 10, and then maybe you've got dividend paying portfolio that generates another X. But you can see here, year over year over year, with a cost of living factored in, it shows exactly what that gap is so that their financial professional can really make some good retirement income determinations for Pat and Kelly. Also, it indicates any inflection points. For example, Pat passes away, Kelly would then move over into a survivorship benefit. So this is what the fact finder or the questionnaire looks like. Very simple. Again, you fill it out. Your financial professional sends it to us. We send them the report. If you like, they can get on a call with us and you to kind of walk through it if that's desirable. But the questionnaire might take 10 minutes to fill in. And a couple of things. We do not want your Social Security number. There's no spot there that says, what's your social? We do not want your Social Security statement. We are keeping this as confidential as we possibly can. And moreover, this report, although we don't want your questionnaire, it's probably your benefit statement. It's probably a really good idea to have your most recent one available because, the best data in, the best data comes out. This is what we call the Social Security analyzer because it analyzes all of the rules, discards the ones that aren't relevant to you, kicks out the ones that or when creating these different paths, makes sure that no rules are being broken by indicating one path versus another. So again, for many, many people, it's been very helpful because it kind of serves as one of the big pieces of that retirement income puzzle. And it's a guaranteed income stream, which is never a bad thing. So with that, just know that when and how you file is super important. There are other family members that might be relevant to that decision, a spouse, for example. And I mentioned a piece of the puzzle a moment ago. Your retirement's a big picture, and you have different puzzle pieces in that picture to put it together. There are income pieces, there are expense pieces, healthcare, as we just reviewed a short time ago, big expense, and Social Security is, certainly a very desirable income stream. So with that, Thank you so much. Again, my apologies for my computer. It's usually pretty dependable, but today decided to kind of drive me crazy. Carla, I'm going to turn it over to questions. I've got all the time you all need and want to take. But if you've got questions, please let me know. If you have questions you think of later and want to check with your ClearStep financial advisor, they have access to us and can get questions answered through that pathway as well. Thank you, everybody.
Thank you, Roberta. So yes, if you do want the healthcare long-term care cost assessment or any of the tools that Nationwide provides, please reach out to your financial advisor for that additional information and we'll help you with that. So do you have any questions? Any specific questions? Like I said, otherwise reach out. We can get the answers for you if anyone does have specific questions on your benefits, any of the details that Roberta went through, we can help you with that. That's what we're here for, to be able to give you that information.
And I'll leave you with a couple of thoughts as well. Remember, the reports that we can generate for you do not cost you anything, and they are confidential. So your advisor can get those questionnaires for healthcare and for Social Security in your hands. Very simple process to fill that out.
Excellent. Thanks, Roberta. Well, Roberta, we appreciate it was an excellent presentation with information. There was a significant amount of useful information shared. We greatly appreciate that. And with that, we are going to close out today. So thank you all for being on the call, and thank you, Roberta, as well, for being here with us and sharing this information.
Thanks, Carla. Appreciate
Thank
it.
you.
And we will talk soon.
Thank you. Okay, bye-bye, everyone.